For many students and young doctors, the kidney is considered a touchstone in learning physiology and pathology. Understanding the leading role of sodium in renal function and regulation makes the things much easier. The arterial supply of the kidney starts with segmentary, lobary, arcuate and interlobulary arteries, from which the afferent arteriole of the glomerulus emerge, continuing with the glomerular capillaries, efferent arteriole and vasa recta. The arcuate vessels mark the limit between the cortex and the medullary, which contain different populations of nephrons with different roles. The great majority, the cortical nephrons, are involved in filtration, reabsorption and secretion, their vascularization being the most sensitive to autoregulation and vasoactive regulation. In the meantime, the juxtamedullary nephrons are involved in the mechanism of concentrating and diluting urine, the countercurrent multiplication. Filtration is dependent by the afferent arteriole pressure, efferent arteriole pressure, oncotic pressure and retrograde urinary pressure, important in obstruction. Its regulation will be discussed later. Reabsorption is important in the proximal tubule for sodium, potassium, bicarbonate, glucose, phosphates, amino acids, calcium, chloride, water, while the distal parts of the nephrons complete the sodium, potassium and water reabsorption and secrete hydrogen and potassium. The engine of reabsorption, secretion and countercurrent mechanism of concentration of urine is the sodium-potassium pump, which consumes ATP generating ADP and phosphate and adenosine as breakdown ATP metabolite. The latest becomes important for metabolic regulation of glomerular filtration, most studies suggesting adenosine as tubuloglomerular feedback mediator. Sodium-potassium pump creates the sodium concentration gradient between the lumen and the intracellular space, facilitating sodium reabsorption. Sodium is the vector of glucose, water, phosphate, amino acids reabsorption, and is also exchanged by pumps with other cations, potassium, calcium, hydrogen. It creates the electric gradient for hydrogen secretion in distal nephron. The active reabsorption of sodium in the thick ascending limb of loop of Henle, impermeable for water, while the descending limb is impermeable to sodium, creates the hyperosmolar medulla, which attracts water and urea from the collecting duct, concentrating the urine, the countercurrent mechanism. Sodium also has the leading role in the regulation of the kidney function. Macula densa from distal convoluted tube is adjacent to afferent and efferent arteriole of the glomeruli. It senses the sodium concentration of the urine and, by adenosine, regulates the tone of the afferent arteriole and, for a lesser extent, of the efferent arteriole of the glomeruli, modifying the filtration pressure and consecutively the glomerular filtration rate. This is the tubuloglomerular feedback. The adenosine also inhibits renin synthesis, which diminish the renin-angiotensin-aldosterone system activity. Angiotensin acts opposite to adenosine, constricting preferentially the efferent arteriole of the glomeruli and rising in this way the filtration pressure, trying to preserve the filtration function and modulating the tubuloglomerular feedback. Other factors, like autoregulation and sympathetic stimulation and consecutive vasoconstriction of preglomerular vessels, vasoconstriction induced by endothelin, vasodilatation induced by nitric oxide, prostaglandins, atrial natriuretic peptide also modulates the glomerular flow and filtration in normal or pathologic conditions. This is an evolution-adaptive mechanism to preserve the body volume and renal function in volume depletion, for example in hemorrhage or dehydration, despite the centralization of circulation to the most vital organs, brain, heart, and lungs. This also occurs in other pathologic conditions, like heart failure and shock, liver cirrhosis. Thank you. If you liked, don't forget to appreciate and subscribe. See you again.